According to data from the World Health Organization, a postpartum hemorrhage, or PPH, is an obstetrical emergency affecting an estimated 10% of all live births. It is the most preventable cause of maternal death. Every 4 minutes, somewhere in the world, a woman dies of PPH. Not only the developing world is affected, but industrialized countries as well. The complication can arise with both vaginal and cesarean deliveries, but it is approximately twice as frequent after a cesarean section. The uterine arteries pump 500 to 700 milliliters per minute into the site at which the placenta is attached to the uterus. After birth, this blood could potentially flow into the uterine cavity and be lost from circulation. In most cases of vaginal delivery, however, the myometrium contracts firmly, compressing the blood vessels and thereby reducing blood flow. A cesarean delivery, although very common and routinely performed, can increase the risk of a PPH developing due to the insufficient contraction of the uterine musculature. The definition of PPH is based on loss of blood, approximately 500 milliliters or more after vaginal, or approximately 1,000 milliliters or more within 24 hours after cesarean delivery. Among the various possible causes of PPH after cesarean delivery, uterine atony is by far the most common. Pabal, with the active substance carbetocin, is indicated for the prevention of uterine atony following delivery by cesarean section under epidural or spinal anesthesia. Here is Professor Tim Draycott to tell us more about Pabal.
Hi, I'm Tim Draycott. I'm one of the consultant obstetricians in Bristol and senior lecturer at the University of Bristol, but mostly a working everyday obstetrician. We know that bleeding after delivery, so bleeding in the third stage of labour, is a particular issue and seems to be increasing, particularly in high-resource settings. And seems therefore to bring a number of benefits to help the uterus contract down and reduce the risk of postpartum hemorrhage after caesarean section. The main advantage, certainly in our randomised work, was that the patient didn't require additional oxytocics, additional drugs to make the uterus contract, as well as carbetocin. The women managed with carbetocin spent less time in recovery and less time on the labour ward after their caesarean section.
Carbetocin, the long-acting analog of human oxytocin in Pabal, specifically targets uterine atony.
Carbetocin has a slightly modified chemical structure, improving its stability and extending its half-life to 42 minutes. It stimulates uterine contractility within 2 minutes and lasting for 1 hour, and also raises uterine tone.
Pabal is administered as a single intravenous injection of 100 micrograms per milliliter of carbetocin over 1 minute, only after delivery of the infant by cesarean section.
After injection, carbetocin is carried rapidly to its site of action, the smooth muscle cells in the uterus. Here it binds to oxytocin receptors. In this way, a signaling cascade is started. Prostaglandins are produced and calcium is released from intracellular pools. As a result, the smooth muscle cells of the myometrium start contracting regularly. This causes the leaking blood vessels in the uterus to be compressed and to constrict. The prostaglandins also stimulate intravascular thrombosis in the placental bed. The overall effect? The bleeding stops and uterine involution is furthered. Guidelines for treatment in Mexico, Canada, and Poland already recommend carbetocin as a first-line therapeutic option for the prevention of PPH. Just like oxytocin, the natural hormone in a mother's body, carbetocin regulates physiological hemostasis and uterine involution, providing a good start for mother and child.
Carbetocin, the active substance in Pabal, is a long-acting analog of oxytocin with a rapid onset of action. It is cost-effective, restores uterine tone, and has a good safety and patient tolerability profile. Pabal, one step ahead of uterine atony.
contraindications are pregnancy and labor before delivery, induction of labor, hypersensitivity to carbetocin or oxytocin, hepatic or renal disease, cases of preeclampsia and eclampsia, serious cardiovascular disorders, epilepsy. Warnings and precautions. Use carbetocin only at well-equipped specialist obstetric units. Determine the cause of uterine bleeding, if any, after administration of carbetocin. Usage intended for single administration only. Risk of water intoxication should be excluded. To be used with caution in the presence of migraine, asthma, and cardiovascular disease.
It must be administered slowly over 1 minute.
Use in gestational diabetes mellitus and post-vaginal delivery has not been established in clinical studies.
Interactions. Specific interaction studies have not been undertaken. Since carbetocin is closely related in structure to oxytocin, the occurrence of interactions known to be associated with oxytocin cannot be excluded. Undesirable effects: headache, tremor, dizziness, hypotension, flushing, chest pain, dyspnea, nausea, abdominal pain, metallic taste, vomiting, pruritus, back pain, feeling of warmth, chills, pain,